We're so excited to hear that you've booked your surgery with us here at Watt Plastic Surgery.
We're going to go through a few important details as far as your specific surgery and things that you need to know ahead of time so that you're able to have the best recovery possible.
We've created detailed videos for each procedure. Now we're going to talk about an upper eyelid lift or a blepharoplasty. Upper eyelid lifts involve an incision on the upper lid that's hidden in the natural lid crease. At 1 week, your sutures will be removed at your post-op appointment. It's important during the week following surgery that you keep your incisions moisturized with Aquaphor ointment. You'll put a rice grain sized amount of Aquaphor on your ring finger, gently apply along the incision line twice a day. When washing your face, it's important to be very gentle and not directly scrub the upper lids. Gently splash water and a mild cleanser on the upper face and allow it to run down the face to remove any crusts or scabbing that may be present. It's important to use artificial tears if you're feeling dryness of the eyes or irritation, which is not uncommon after this surgery. When you're sleeping after surgery, it's important to sleep with your head of the bed elevated with 2 pillows. Keeping your head elevated decreases your amount of swelling and brings down the amount of bruising more rapidly. Eyelid surgery is one of the only surgeries that we allow you to apply ice to your incisions.
The best way to do that is take a bowl, fill it with ice water, and then take the soft surgical gauze, place it in there, let it soak up some water, wring it out so that it's not dripping, and then place that over your eyelids. That will help cool the incision, give you a little bit of pain relief, and the moisture will prevent it from sticking to the incision.
Once your sutures have been removed, you'll be given a link to purchase scar gel. You'll begin applying that similarly to the Aquaphor by placing a small amount on the ring finger and gently applying to the upper lid twice a day. As you apply it, you want to apply light pressure to help with the scar healing. You'll be allowed to begin applying eye makeup as soon as 10 days.
So we've gone through all the things that you need to know for the specific surgery that you're having. Now, just a general list of things that you need to know, kind of regardless of what surgeries you're having or what surgeries you're thinking about having in the future.
Never use a heating pad after surgery. We do not want you applying any heat to the area.
That also goes for hair dryers and ice packs. Even though ice is not heat, it can still burn you and leave very not great looking scars.
No sexual activity for at least 4 weeks after any surgery.
No exercise. And I know exercise is, especially in South Tampa, everybody wants to do something. They want to exercise. They want to be out and about. You need to not. And exercise means no going for a walk, even around the block. No walking your dogs, regardless of how big or small they are. No weights on your lower body if you just had upper body surgery or vice versa. No yoga, Pilates, nothing. If it's something you have to think about whether or not we would say, yes, you can do it, you can't.
No swimming for at least 4 weeks after surgery and no baths. For optimal healing, it's important that you avoid smoking or vaping for at least 4 weeks after surgery. It's a really exciting time in the medical field with the age of GLP-1 medications. With that, we've got a couple restrictions and recommendations to ensure you have the best results possible with your surgery. With surgery, you're investing your time, money, and recovery to have an amazing result. But if you continue to lose weight after surgery, you may have excess skin that recurs that you'll want to remove. We want your results to last, so maintaining a stable weight within 10 to 15 pounds is crucial to ensure a lasting result.
If you're considering a tummy tuck or a breast reduction or breast lift, and you're considering losing more weight before you would want to have that surgery, you can have a consultation with one of the members of our team to talk about the GLP-1 medications and if those could possibly fit into your treatment process. The bottom line is just make sure that you lose whatever weight you want to lose before you have those surgeries. Try to get within 10 or 15 pounds of that goal weight before you have surgery. The other important thing is all of those medications kind of affect your nutrition and how much you're able to eat, which then means how much protein you're getting. That directly affects your wound healing. So even if you stop those medications, you need to make sure that you eat an adequate amount of protein for your body weight to be able to make sure that you have enough nutrition, that you're able to heal the incisions, and that you don't have poor wound healing or other complications in the immediate post-op period.
No matter where your surgery is done, from head to toe, no tanning or sun after surgery for 4 weeks. After 4 weeks, if you are going to go in the sun, it's important to put SPF 50 or above on any incisions, even if they're below the bikini. The sun rays can go through clothing and still cause darkening of your scars. After surgery, we want to ensure that you have the quickest healing possible and make sure that there's no medication interactions. A lot of supplements can cause inadvertent bruising, bleeding, or interact with the medications we prescribed you. The only medications or supplements that you can take have been advised to at your pre-op appointment. The only vitamins that we recommend or allow are a multivitamin for 4 weeks after surgery.
If you're having surgery, regardless of what surgery it is, you're going to have a coupon book that you go home with. One of the things in there that's important is discounted scar treatments. Those can be very important to make sure that you heal as best you can and that the scars look as good as they can. Your esthetician or nurse practitioner that you see will kind of know the best timing as far as when they want to start each one of those individual things.
Common treatments our estheticians provide for scar care are microneedling, laser therapy, and also pharmaceutical grade medical skincare to help for the best scars possible.